the cases in developing worlds are increasing in people below 50 years. And yet in the developed worlds, cases are still high, but are common amongst people above 50 years. Should this, I mean, my grandmother and yours may not have attended school. And so the people who lived in the early 90s and before, women were not the focus, okay, in academics and things like that. Why would the incidence of breast cancers amidst women below 50 years concern any developing world, to include Uganda?
Thank you very much. Globally, what is happening is the concept of women or woman emancipation. So we are trying to, globally, you see all nations are trying to see to it that we tap into the resources which are in a woman. And it has worked well. As you are all aware, that women have become, in most circles and parts of the world, the backbone on which the economy is moving. But we should also remember that us in the developing countries, our populations are quite young. And that's why you see that the lifespans, I think of Uganda has just risen to around 60 to 65. It has been between 40 something to 50. So that means an equivalent of a 90-year-old in the Western world is an equivalent of about somebody who is about 45 to 65. So, and we have this rare commodity in women. We've engaged them, we have trained them, we have equipped them, and they had reached there. But what do we see? That we are losing on this variable population in society. These are ladies who have just left school, have just enrolled for employment. They are at their peak of productivity. In any society you can think of, in church here, if you are to scan around, the people who would be more frequent on the pulpit are women. In the different departments, we have women. The same is true, even in the government circles, that you see young women, they are not very old women of 40 plus. They are usually 20-something to about 40 max. So, this rare commodity, that's why in the UN Charter, they came up with what we call the Sustainable Development Goals. And one of the pillars, I think it is Pillar 3, it is concerning women's health. So it is a big thing which we have to put into consideration, not only for the outside world, but also for the church. Because we are losing out on these people, this population, which is pivotal in whatever we are doing. In any realm you can think of, be it military, be it education, be it agriculture, and even in home building. So, if we lose out to these ones who have just left school, have attained the education which is required to compete with the main population, then we are at a loss. So that's why we are concerned and we are bringing this to your attention.
All right. What I get from the early presentation is that all ladies in this church that at least are of age above senior 6 should go for the screening. Okay? So the incidence is coming in younger ages. You know, this cancer, according to doctor's presentation so far, is not like gray hair, that it is common amidst the elderly. But even gray hair, today young people are growing more gray hair. So don't be seated and you're like, me, I'm still young. I'll go when they come back in 2036. Okay, so another 10 years wait may be detrimental. So as we talk about this cancer and the increase of non-communicable diseases in young communities, people should be asking, what causes this or these types of diseases, what could be, as doctors and experienced practitioners, what have you come to find out are the probable causes of non-communicable diseases and cancers that are rising so much of late?
Thank you once again. Of course, one of the challenges regarding cancer care is cause. And unlike for a few cancers, like maybe where we have come up with the actual cause or the main factor leading to its cause, like in cancer of the cervix, where we know that a given virus, HPV, will affect somebody's cervix and later on after some time develops into cancer. Most of the cancers we have globally, we don't know the actual cause. But what have you observed over the years when we are trying to try and care for these cancer victims is what we call associated or risk factors. That who is likely or who has been observed to develop such a problem. So, first and foremost, when we go back to dwell more on cancer of the breast, the main factor is being a woman. So, being a woman puts you as high as it were to develop breast cancer because your breasts are well developed and they are more prone to develop into a cancerous stage or a cancerous situation. Of course, the other thing is to do with your makeup. That not the makeup you wear, but what really God used to make you up as an individual, what we call the genetic composition of somebody. Being black puts us at a disadvantage. We are yet to find out exactly what happens in that blackness in us, which forces us to develop more of these cancers, and more so at a young age. But also one thing has been discovered, that there are some genes, especially in some communities, like the Jews, there's what we call the Ashkenazi Jews. Those have a gene which is called the breast cancer gene 1 and 2. Those guys have a tendency, or they are more predisposed to getting cancer of the breast. Having that gene, if you are born and you have it, you are at almost 99% chances of developing it, other than being black or being any other thing. Then what has come into play is what we are observing from the environment we live in. That the environment has taken a toll on us. What do we eat? Where do we stay? And how do we deal with our bodies? If you come to think about it, that what has been observed, that people who are more in a fairly urbanized kind of setting, which is no longer defined of recent, because those days we would say that if I stay, say, for instance, in Masaka, very far from here, I'll be in a rural setting, and I'll be eating possibly food as it were in its natural form. But now what is surprising, that the person in Masaka uses the cooking oil I use here. The same is true with the cooking oil which goes to Karamoja. It finds them at their doorway. So there is that tendency of saying I'm staying in the village, I'm staying in the urban setting, no longer really carries that much weight in it. Even the vehicles we use, all the means of transport we use, it could be the motorcycles, it could be the vehicles. You should remember that the so-called new vehicles on the market are picked from a garbage heap in Japan, or in the Western world, like in Germany or where. They are condemned. So that means what they are emitting to us is hazardous, because that's why they are no longer using them on their roads. In actual fact, if you are caught, you pay tax, which is heavy. And that's why some people end up dumping their cars on the road and go away. So if that's what we are using on a day-to-day basis, the fumes, the food now, when I come back to the food, you see, the population has blown. But in so doing, it has limited the sources of food. So what we have resorted to is trying to keep abreast with the supply vis-a-vis the demand. So what have we resorted to? Instead of plowing the land with a tractor or an animal, we spray. Those are poisons which are kept in the soils. And we plant there fast-growing plants. They harvest the chemicals, but in addition to that, we no longer weed, we no longer wait for plants to mature. Lots of things are happening. I'm not here to decampaign farmers, but this is a fact. Somebody even goes to the market and you send somebody to buy for you tomatoes. We say the fresh tomatoes are these ones which are plastered with the chemicals. Can you imagine such a thing? Yet, in the developed worlds, even meat, you can't get meat killed today and you get it now. It is stored for about 3 months before it is eaten. But for us, from the source to the plate in the body. So there are lots of environmental issues, and also maybe let me conclude with this one, is the way we do or we present ourselves to the environment. Originally, a child would wake up early in the morning, then walks about 1 kilometer or so to go to school. So you exercise your body. You have eaten a heavy meal, which is not very good, but you blow it off. But now what is happening? When the child gets out of bed, either enters a car or a boda to the classroom. When you reach the classroom, you read, you study whatever you're supposed to study. There's no playground, so you sleep. You add on the quantity either in the juices or whatever chemicals you are loading your body with. You continue loading your body, then you jump on a boda back to bed. So your body is not exercised at all, and it is not trying to discharge anything you are loading into your body. So you are accumulating more chemicals, some of which are not that friendly to you, and are some of the factors which really help to initiate some of the cancerous processes in our bodies. Thank you.
Doctor, you raise pertinent issues about what we eat, how we exercise, how we grow what we eat. A few weeks ago I was in a garden and I wanted to plant maize. So the seeds I had at home, they told me those ones will not yield because they came from a processed type of maize. So you have to go and buy more maize from the store. And then I end up planting red maize. So I don't know whether the cobs will be red or it was the color on the seed. But away from that, should we worry about the increasing rate of use of hormonal therapies? Should it be a concern more so amidst our sisters? Hormonal therapies, whether they are family planning methods, whether they are emergency pills, whether it is any other hormone given to treat any other disease.
Yes, we ought to be worried because, you see, your body or a woman's body has given concentrations or amounts of these hormones in the body, and they change in a cyclical kind of manner. Not all the ladies know their selves very well. There are certain things which change within the course of the month, and they know. They even realize that something is about to happen, and they will guard against themselves. But you see, when you load yourself with, say, the contraceptive hormones, regardless of the route, whether orally, whether injectable, whether they are these slow releases, of course they are disrupting your normal amounts in the body and how they are supposed to change over time. So the body is not meant for that. The body is supposed to regulate itself, and that's why in some circles, or even ours as Christians, we do not allow you to practice certain things unless you are permitted to do so, and when you are ready for the consequences. But of course, we are in a sinful world. Anything is possible. Just remember that whatever you do, whatever tablet or drug you take, be it a hormone, be it in a form of any other form of treatment like radiotherapy, whatever is not supposed to be normally used in your body takes a toll on it. And whatever might come, it will depend on how endowed you are. Because we might be exposed. Especially that's why we have a controversy regarding these hormonal contraceptives. One thing is economical. The other thing is to do with the availability and maybe the perceived kind of uses from them. You see, somebody will tell you that, these children should be given these hormones to safeguard them from getting pregnant and that. But when you come to think about, if you are to do some simple mathematics, which is easier, to manage a baby when it is born, or to manage somebody whose outcome you are not sure of when a certain condition has developed in this person? It is all upon you, but of course I am not here to campaign the use of hormonal contraceptives, because as a church, there are some areas I don't want to overemphasize by the nature of what we are and what we profess to be. That there are some things, we use them because we are sinners, I agree, but if you can, avoid and do the needful. It is the same thing to do with alcohol. That's why I've not dealt much on it, alcohol and smoking. Of course, I know some of us do practice these things. It might be openly, others might be innocently, because I know some of you here drink what they call water, wine, and something. But what is wine?
It is alcohol.
That's what you should know. So however much you dress it in whichever manner, you should know what you are doing and be ready for the consequences.
Okay, I won't dwell into that also, because some people in cakes, to preserve them, they want to preserve them for very many years. So you may find a lot of alcohol content even in a cake. But I know some decisions are really deliberate. Many of the ladies have had of friends that have ever had a breast lump. Or a person here may have ever had a breast lump, and maybe it was removed. Should they worry?
Yes and no. But let me start on the yes side. Studies have shown that whoever what we call a simple, but in the scientific language we call it benign condition of the breast. It could be just a swelling and it dies away, or you treat against it and it is cured. The same with true with some of those masses. It could be after that your breasts are not really normal as some people put it. But you need to be followed up. It might end there throughout your lifetime and nothing else develop. But some studies have shown that there is a bit of relationship, that those who have ever had a fairly simple abnormality of the breast who are at a bigger likelihood of getting development into cancer, unlike the other one who has never had anything. So yes, that I would say it is true. You need to worry and intensify your follow-ups with your physician or whoever, or yourself. You continue doing the needful by monitoring how your breasts are changing. But on the other hand, as I have to re-emphasize that, it could end there if it has been treated and really checked thoroughly by those who know exactly what they are doing, and declare that is a simple thing which is curable, and ends there.
Okay. Many people are tired visiting hospitals. For everything, I go to hospital. For everything, I go to hospital. And the doctors of late have issues with consultation fees. So before you see me, you have to pay a consultation fee. So how can somebody, because this breast is on a woman, and she moves with it every day, can't somebody check themselves and they know that something is happening, what could be the available approaches?
Yes. Of course, as the whites say, I don't know whether the whites or the Western population say that charity begins at home. If you know who you are, then it will be very easy to determine your next move. So the breast is on me, is on that lady, is on that gentleman or young man. First and foremost, you need to know, especially for the ladies, you need to know your cycle very well. There are those who have an irregular cycle. But all said, we should remember that the breast mass changes towards your cycle, within your cycle, and afterwards. So what do we recommend? Usually, when one has started a cycle, so like the flow has begun, then you need to count 5 days from the beginning or the onset of your flow. Then from the 5th day to about the 10th day. Around that period, your breast is turning back to normal, because if you reach the 14th day, it has prepared to initiate another cycle. So around that time, from the 5th day to around the 10th day, you are supposed to know the character of your breast, or breasts in general. That you should know how they are shaped, how the skin looks like. Then when you are done, I know you have your private time. Whether you are going to bathe, you get time off, put a mirror before you. You don't have to put somebody there to show you what is abnormal. It is better to use a mirror so that you are comfortable. And you look at yourself. Of course, you must be half full dressed, the top off, and your breasts are well exposed. And you look at them. First, you observe them and see. My nipple is always here, facing here. Whether it has physiologically moved from one position to another, you accept that's where it is. It is not a crime. It is a normal occurrence. So, be in the know of your breasts every month. Don't skip. Be religious enough and look at your breast and know them. Then when you are done with the observation of your breast, now go ahead and use the opposite hand of the opposite. If it is the left breast, or the right breast, so you use the left hand. Use your fingers like that. So that make sure you are able to feel every part of this kind of hip made by the breast, from the mid-bone here to the armpit. You do that to make sure that every area is filled. Then if you feel anything, be it pain, be it some grittiness or some mass effect you can't really appreciate, check it the next month. If it is still there, then act promptly. Because for us, we have a slogan in cancer care that cancer doesn't respect latecomers. So act promptly against all odds and visit somebody to check them. Now you have done your self-breast exam. Now go to somebody who can do a clinical exam and tell you whether there is need to examine you further using machines or not. In actual fact, you have to do that for those who are still active. But for those who have passed the time and they no longer experience the flows, then you get a time T in the month. You say, on the 12th day of every month, I'll be examining myself, and put it in a black and white and say, you know what, this is what I'll be doing. Every 15th day, it is even better you get a record. You have a book of your own and you write and say, this is like this. For the young one, at times we even tell them to get a book, and some of them usually complain about some ache or some pain. Then you draw a table You say when the flow was this much, the pain was this much. You can grade it in your local way. Then when we come and you come to us and you are interacting, you'll be able to tell us, no, when this cycle is this way, this happens this much. So we give you an interpretation, which is due from the expert side, and then all will be well with you.
Thank you, Doctor. I'm wondering, when Doctor was showing us the fingers, ladies were not following, apart from one person. Ladies, they said use which fingers? From the opposite what? Then you put two? So he said you move from? Others who have been up there, you've seen. Please, those things, however basic they are, do them diligently. If the only mirror you have is the one in the bag you have, get a bigger mirror. Because for you to appreciate how this is happening, you should be able to see your entire chest in a mirror. So if you are using this one that sees one breast and then another one, that one will not what? It may not help us. So get a bigger mirror and make it your friend, at least routinely. In the introduction, Doctor, you indicated that more than 6,000 people die annually in the entire world to breast cancer, right? So if that magnitude of people are dying, are there any services available to manage this menace? And could there be any survival stories or survival rates?
When you look at the figures I started with, I said about 2.6 million get the condition every year. And of these, 600,000, 600, not 6,000.
600,000 die.
Just slightly above 0.5. You know, these days you are used to millions. Just above 0.5 million people die every year. I don't know the population of Kampala offhand, but I think it's about 2 million.
13 million.
Kampala only?
Yeah.
About 13 million. But anyway, if you are to take the population of, say, I think it was the national census that the people in the central, the so-called Baganda, about 6 million. So you just imagine that the entire population of the Bagandas, you know, almost 10% die every year. So that's how serious the condition is. Yes. Having said that, we have not also given in, or to use the sporting term, we have not thrown in the towel to accept defeat. There is something we can do. First and foremost is what we are doing now. We create awareness to show you the magnitude of the problem and who is likely to have a problem. We've agreed, if you were lady here and you were about to, let me say 20 plus, take it upon you that I'm at risk. But also men are not spared. I don't know your genetic background. You might find that you know, these cancers are related. It could be my dad died of CA of the prostate. Maybe my aunt died of cancer of the cervix. So these things you have to put them together. So what are we able to do? I said we create awareness, the survival stories. If you look at the figures, we've said that if 600,000 die, then at least the survival is still there. But the survival is somehow structured. It is not that, of course, they will die of other causes. But when you are referring to cancer, we have it that the 5-year survival, if you are in care, is about 75%.
That's great.
So then about 10 to 15 years, it is about 45, 30, between 30 to 45. So you see, it is a big thing, and it has a big toll on the human population. So when you are aware of what can happen in your breast, utilize the services near you, the professional services. You have doctors, you have, for ladies who are still active, you can visit your midwives when you go there. make it a point that you as a lady, when you go for any condition, be it malaria or something, ask your physician or your health provider to check your breast. It might be a private part as you damn it, but anyway, for me, I usually tease my people that for me, to check your breast, you have to pay me. For others, you can keep them to yourself, but for me, you have to pay because that's my work. And I earn a living from that. So you need to utilize your services. Whenever you pay your consultation fee, utilize it to the maximum. Ask this person to examine whatever you've heard of. Unless one is very busy, but most of these people who are professional would be able to give you some 2-3 more minutes to satisfy you with your requirements. Then, of course, one thing maybe which we have not alluded to throughout our discussion is that breast cancer, why we create this awareness, is something which is called a silent killer. By the time you notice that you have a problem, it is rather late. Most of us move around here, you've had a swelling or something, you've seen your breast and you have taken it as a normal occurrence. That is very bad. Whenever you have anything abnormal, be it a small mass, be it an induration on your breast, be it maybe pain you can't explain, please visit somebody who knows. Because the earlier you visit the services which are available, the better the outcome. Because also us, when we are managing you, we have our grading regarding the outcome. There are those we are sure they are going to cure if they come early. If I'm to use the simple stage and say, if it is stage 1, we are almost 100% sure that we will cure you. If it is about stage 2 to 3, maybe we can do something. But when it is 3 and 3 towards 4, not yet 4, then we are able to prolong your life. You see, we have changed now our goals. It is no longer cure, but we are trying to
prolong life.
Prolong your life. Because we know the disease has gone somehow far. But if it is stage 4, then we are making you comfortable until, as the world will say, before you meet your creator. Sure. Because the disease has gone, it is out of hand, it is in the chest, it is in the back, it is in the abdomen. So, however much we have been endowed with this gift of healing, we might not go that far. But of course, we don't say that because you've come that time, the following day you are dying. Don't misquote us. And we don't put a time factor that in 2 days you will be gone.
Thank you very much. Thank you, Doctor, so much. Dear viewers, we want to emphasize that we have been looking at breast health in women health, and we're saying that this is a silent killer. Maybe a caution, I want to say that the knowledge, the little or some knowledge people get of social media, that one of the treatments may involve cutting off the breast. Some of us love our breasts so much that thing is happening, but every time you think Dr. Makumbi will cut off the breast, you delay home. So it doesn't prolong life, dying with both your breasts. Yet maybe one could have been removed. I don't know that we should do a bonus, Dr. Makumbi. Is there, if the stage is, let's say, 2 or tending to 3, and removal of the breast is the solution, can you get me another thing that fits in my bra, such that when I put on, it looks well and I can fit in my clothes?
Those who are here last time, I brought some of my survivors. They shared with you, and some of you were even wondering whether it were true that their breasts had been removed. But of course, as we say, necessity is the mother of invention. So we've realized that because of the need to fill up the gap left behind by loss of a breast, if that is the treatment given at that time, there are so many things which are possible. The survivors themselves, in some, I would say, they innovated. They came up with an innovation of a bra. You see, this bra, the one side is holding the breast, but this side it is flattening. So they realized that, no, they can fill up the pocket of the bra with something, and they are now having their bras. In actual fact, they sell them out. They are, whatever, they would be new victims of the conditions, and they are good to go. But there are other things which we can do scientifically. We can operate on you later. I wouldn't recommend, it is possible, it has been done elsewhere, that in the same setting, you can be operated, then also the breast which has been removed, reconstructed through another procedure, using parts of your body to put up a hip there to act like a breast. But you should remember, that is not a functional breast. And the aim in cancer care, especially in a surgical approach, is to make sure that you are alive, then we do the other things later on. In somebody we are sure is cured or is alive. It doesn't really make sense to us to come when you have a big problem that you say, no, you see my breast, I can't part with it. What you can do, maybe remove a part of it, leave me with a part, then so that I can have something. Of course, that might not be the best option. To some people, they might yield because of economic issues, but I, for one, I rarely accept such. Because by the end of the day, you come back and say, you see, the disease was not treated well. Yet the best option, even though you are here, even though you go to the Western world, they will tell you, the best option, would you rather lose the breast? In actual fact, we have not reached there, some of us here, or the countries like in the third world. But what is happening out there, that they have gone ahead, like I told you, those people who have been identified with the genes which really cause breast cancer. People go early and they lose the breasts. They have other prostheses. There are things. There are lots of surgeries which are in use. We can put an implant in there, then we cover up the skin. But what I want you to know that we can't put back your functional breast, but we can hip up something there, and you look good.
All right.
Okay?
That looking good, I see people are smiling. I think they know there's one socialist of late who is looking good after a couple of surgeries. At this level, we want to welcome any concerns from our audience. If you have a question to our guest or something you seek clarity, in marriages they say declare it now. So, but I request that let us have the questions. If there's any question or concern, let us have it addressed now, and then we can go to the other session. Any concerns? Thank you. You may have to come a little closer.
Thank you so much, Doctor. My question is, if you're still breastfeeding and they cut off the breast, what happens? And then also, how can we minimize the cause? How can we minimize the cause for the people who don't have the disease yet? Yes.
Anyone else with a question?
Yes, people with concerns, I request we dress forward and we minimize some time. Thank you.
Yes, good evening. My question goes to the doctor that And sometimes we've heard that we have stages. And some of the victims, they don't know when they have already, whether they are entertained with this capacity of cancer, they don't know. You find that sometimes they say you are from stage 1, now you are at stages 3 or 4, like that. Then my question, I want you to at least have a clarity over the symptoms and signs to the victim. Because some people, you find that they say they have diabetes and they relate to cancer. The last question goes, do we have any kind of medicine, apart from operations you always do? And we be sure that if I don't go such an operation, I may get my cash, I am given the medicine. Last but not least is that how can somebody from village deep there being just given this awareness you've given us? How does the government do this? Not on a personal basis, but as a government as well. Do you have any of a kind of advice or no? Thank you very much.
I have 2 questions to ask about cancer. The first question is, how do we prevent? How do we prevent and how do we control ourselves from getting this disease called cancer? And the second one is, how many types of cancers do we have? Because we are only hearing here about breast cancer only. So maybe there are others also we have to know about. That's my question.
Thank you so much for encouraging us and also being attentive in a manner that you are able to follow through and be able to ask these really interesting questions. First and foremost, somebody asked about breastfeeding as in line with the breast surgery. Well, as you know, surgery is a specialty, and it has precautions we go through before we do whatever we do. But all said and done, when one is diagnosed with breast cancer and is breastfeeding, usually we call this one is an aggressive or a rapidly growing type of cancer, usually to do with pregnancy and those who have just delivered or lactating as to where breastfeeding. So we take you through our management scheme. We examine you. We do all sorts of investigations with machines like ultrasound there. But there are some we reserve, like mammography and CT scan, because those are not friendly to a breast in that phase. It might cause more problems. But surgery is possible if it is indicated. Don't be worried about what you see flowing out of the breast. The breast, however much is seated here on your chest, it can be identified from the other tissues around it and can be operated on successfully, and you won't have any milk flowing. It is not that it's flowing from your body through the breast there. No. The entire bag of whatever, where the milk is, will come off. The wound will heal well. And of course, we'll cater for the other issues to do with a weakened immunity of a woman who is breastfeeding. So it should not be a deterrent unless the disease is out of hand, that we can't operate and we leave later. Then to minimize or to prevent, I think that one we'll put it together. One thing I said is to create awareness, because cancer, let me first focus on this cancer before I attempt the other question about the other cancers. Cancer of the breast is one cancer which is rather stubborn and fatal if not really handled quite early. So what do? We share this information so that you are able to detect it early enough so that we can treat you to the best of our competencies. Then, of course, the other things we do is to tell you, as I said in the beginning, that there is no X which causes Y, which is cancer. So that will be very easy, like what you see in women with the cervical cancer, that we immunize you against the other virus and chances of getting cancer are lessened. But here, we try to share this information so that you safeguard yourself and your body from these factors which have been observed to be related with it. That's why we mentioned things like hormonotherapies in whatever form, sedentary lifestyle, you feed well with fairly good foods as indicated, and we have, I think, that mnemonic of New Start in the church. You can apply it, it does wonders. So then you exercise more regularly and to seek medical advice as early as to where. If we do that, then it will be good to go. Then staging, my friend alluded to that he has had the stages X turning into Y all of a sudden. Of course, it is true. Unlike the other conditions, like say you have a bout of malaria, the bugs enter your body, and maybe you treat them, you have a given drug which has been tested and will kill them. If they are killed, you are good to go. The body will reconstitute and it's done. But in cancer, it is your body which has turned against you or to the commands of the body. So it is part of you. That's what we call cancer. That the building blocks of your body, which we call cells, have rebelled against the commands of your body.
True.
So they are behaving abnormally. That's why if a finger was supposed to grow to this size and it becomes cancerous, it can become like your thigh. It will continue growing without restriction because the body has that innate capacity to stop it from growing beyond a given size and shape. But now, these are cells which are doing that. So, if you don't get attended to in the shortest period possible, if you have stage 1, it will go the way up to stage 4. That is the normal trend of events. That's why we are laboring to tell you, please, if you realize there's something abnormal, do the needful. Then the signs of symptoms, normally, cancers are a problem. Cancers, in themselves, they will distort the shape of that part of the body which is affected. That's why you can have either a swelling in there which was not there, or a wound coming in there, or you start discharging. Instead of breast milk, you can start discharging like blood through the nipple. All of a sudden, because this disease is doing something contrary to what is supposed to oppose what the normal body is supposed to do. But usually, in the early phases of the disease, that's why we call it a silent killer. There is nothing in your body you will feel. Even in the breast, you might think my breast is becoming bigger. You live by that. But if you are in the know of your breast in every period of the year, you say, when I examine, my breast was like this. There's something now protruding this side. This thing is not normal. That could only be the only thing. But there would be no pain. Maybe to some, we've seen that they might say, I got some itching there, but I ignored. I took, maybe there was some kind of pricking sensation. It disappeared. But it's not something you can think of that it is really a sign or a complaint you would take to the hospital. So, until it has grown to a reasonable size to affect the integrity of that organ where it is. If it is the breast has grown very big, or it is obstructing some tube which was maybe bringing milk or something, or it has cut into the vessels in there, and you are able to produce now blood instead of what? Or milk. And to others, it can grow in there silently and is painless. You know, one of the big, I think number one cause as to why we go to hospitals is because of pain. You can have your thing there, and you say, it is just growing abnormally. Maybe it will go. And if you come from this part of the world where I come from, we have all sorts of names. Talo, Simabusuko, is this one they call what? Bani. Somebody's breastfeeding. You see this thing, mastitis termed Bani. Then the other thing. All sorts of things. They have a name to it. So in so doing, you are sitting on a time bomb which is what? It will explode any time. So the other things, like he mentioned, that maybe somebody might confuse it to diabetes or something, that usually at a later stage. But what you should know in the beginning, cancer presents virtually with nothing. To be silent unless you are keen and you examine yourself and say there's something wrong here, let me see. Others come. Of recent, I had a mother came to the clinic there, brought her kid, a child who was about 12, with a breast mass. So she said also, as we were talking, you know, we tried to engage them. Then he told me, but I also have this small thing here I've had for about a year, but it's not painful. So I said, you know what? How old are you? I'm about 40. I said, no. You go, they scan this thing, because there are some characteristics we see. On the scan. We say, based on this picture, we need to put a needle there and examine the actual tissues inside there and see whether it is the bad type or the good type. Guess what? By the time she came back, somebody who escorted the other one ended up having a bigger problem than the other one. But she was not complaining. So we have to be on the lookout. So the other comorbidity, diabetes and those other things, yes, they are there, but they can't stop you from having cancer as a separate entity or together with that. The medicine, as opposed to surgery, for some cancers, like those of the lymph nodes and blood, well, some cancers we have treatment, drugs for it. We can give you and treat you. But when it comes to what we call tumors which form a mass, for us in our language we call them solid tumors. Be it a bone swollen, be it those swellings maybe could be in the muscles. As per now, we don't have drugs which can take the place of surgery. In actual fact, we use a concerted effort because of the seriousness of the matter. We combine. We do the surgery. If the disease is at a later stage, we first give you what we call cancer drugs.
Chemotherapy.
To lower it down. Then we also add the surgery. Or we start the surgery and complete with the chemotherapy or monotherapy, whatever we have in store. And of course, the prevention, we said, of course, my mom who asked about the types of cancers. Just know it, that any part of your body
can have a cancer.
Can riot against you. And this is what we call cancer. So the normal integrity of your body, if it riots and it can go into any form of cancer, be it the skin, be it the blood, be it the bones, be it the breast, be it the cervix, all those can give rise to cancer.
Thank you, Doctor, so much. Thank you, our audience, for the questions. Maybe somebody was concerned, why breast cancer, why not other types of cancers? Awareness can only make sense if we handle one at a time. If we came here and we're talking about bone cancer, breast cancer, cervical cancer, cancer of the stomach, everyone will get confused. So we only pray that as the health ministries of this church continues to prepare awareness sessions, we shall continue to cover other different health challenges. But today, as we commemorate tomorrow, the International Women's Day, this was pertinent to the ladies in this church, and they requested that we talk about it. So, in summary, I want to say that thank you so much, Dr. Makumbi, for saving time to speak to us. He told us emphatically that if we want his services, they are payable. Today, because it is Sabbath, he did not charge us. So, always make sure that when he's presenting on a Sabbath day, you are around. Otherwise, if you're to look for him, you will have to do what? To pay. But, and what I have taken home as one is that all of us need to know how our bodies are. Because the doctor said any part of your body can form a cancer. Let it be the eye, the bone, the muscles of your thigh, the muscles of the back, anywhere. So always look out at how your body looks like, that when there is an abnormality, you identify it early and take it to the responsible parties. Gone are the days when Seventh-day Adventists also believed in witchcraft. So when you see your body is changing, seek medical advice. Nobody can witch a Seventh-day Adventist. Go to the hospital and seek medical advice. Thank you, doctor. Thank you so much. How I request that...
Maybe one thing we have to conclude with is some myths or some practices which are happening. Of course, you might gain the practice from today onwards. You examine your breasts and you are able to catch something. First thing I want to caution you about is how you interpret your health to other people around you. You are the one who has a problem, not your mother, not your aunt. Please take an informed decision. Because what do I see out there? Somebody gets a problem early enough and say, you see, my husband said I should not go to you people because, you know, this breast and what and what. You are the one who is sick. Your mother will tell you how she has somebody deep there where we come from who has a cure, and she had such a problem. Until you know exactly what you are dealing with, please, I wouldn't advise you to go out there and hid. Be it here in church. Because this is one of our other problems. That somebody will get a problem, then we rush to Dr. Jackson's church and say, you know, Jackson, I have this problem. Say, calm down. Everything is possible in the eyes of Christ. I agree entirely and I am a believer. Please, we are gifted differently. There are those who preach, there are those who treat, and there are those who do other things. First, do the right thing in the right time, and everything will go well with you. Be it these other friends of ours who are selling all sorts of drugs around. I'm not part of them, but it's one thing I used to present on one of the radio stations, but because of sharing the platform, I relegated myself from that. I said I can't mix up my people like that. So if you've chosen a type or a line of management, know exactly what you are going for. For me, I told you last time I brought the survivors here, I have something to show to the world that somebody came to me. Yesterday I was chatting with some of my, I call them now, they are my girls, my friends. They came to my office, I was giving them some point of reflection. I said, when I see you now, we are able to laugh, you are bringing me something to take home. I feel good because you are here. But the time we start with them, we are here. Even me, I wouldn't be very comfortable to be told that I have a cancer in my body. But please, let us be informed and do the right thing, Because, you know, cancer is not something nice. And by the time you change your mind to think otherwise, it will be too late and we just be looking at each other helplessly as it were. May the good Lord be with you all.
Thank you, Doctor, so much. Before you switch off the mic, I know that Doctor also knows how to pray. So, Doctor, I request that you pray for us and you give this time to Pastor Chisunka. He also wants to doctor us another way.
So let us stand up. We've been seated for a while. Let us stand up and we conclude the day. Father God, we thank you because you've been so good to us. We started with a prayer and you've taken us through. Whatever has not gone well, Lord, forgive us. We are humans, but we didn't intend to do so. These are your children. You've picked from all walks of life for a reason. They have a duty to do in a mission, but they have to be fit, alive, and healthy. Lord, I pray that whatever we've shared with them today be of help so that they will be able to stand disease-free and able to move on in the mission. I thank you for the Women's Day and also for the opportunity you've accorded us to be here in service. I pray that you remain with us all whenever we'll be. In Jesus' name I prayed.
Thank you so much.